Hey, future counselor, in order to pass your addiction counselor exam, you must understand client referrals. In today's video, we'll review why client referrals are an important part of the addiction counseling process, and we'll also review important referral concepts commonly found on addiction counselor exams so you're prepared on test day. If you're new here, welcome. I'm Letitia, a licensed professional counselor and licensed substance abuse treatment practitioner. I provide mental health and substance use education and trainings. I also help future counselors like you pass their addiction counselor exams. So make sure you're subscribed so you never miss a weekly study video. Now that we're study partners, let's get started. By the end of this video, you'll be able to define client referral and explain why it's an important part of the counseling process. We'll discuss how counselors identify when a referral is needed and how to match clients with appropriate services and resources. You'll also learn how referrals support continuity of care and why follow-up is an essential responsibility of the counselor. And finally, we'll apply these concepts through addiction counselor exam practice questions so you can feel more confident about recognizing referral-related content on your exam. A client referral is the process of connecting a client with services, resources, or professionals who can help meet needs that fall outside the addiction counselor's scope of practice or available services. Referrals help ensure that clients receive comprehensive care by linking them to appropriate supports such as medical providers, mental health specialists, vocational programs, or higher level of substance use treatment. The goal of placing referrals is to address unmet needs, improve client outcomes, and support continued care throughout the recovery process. Referrals are important because no single counselor or agency can meet every client need. Clients may require services such as medical care, psychiatric treatment, housing assistance, and legal services. Referrals help connect clients with these resources, ensuring they receive comprehensive and appropriate care. By linking clients to needed services, counselors can help improve treatment outcomes, reduce barriers to recovery, and support their long-term success. Addiction counselors frequently make referrals because clients often have needs that extend beyond substance use treatment alone. Some clients may need medical care to address health concerns related to substance use, while others may benefit from mental health counseling, psychiatric services, or medication management for co-occurring disorders. Counselors may also refer clients to detoxification programs, residential treatment, or intensive outpatient programs when a higher level of care is needed. Additional referrals may include recovery housing, employment services, and family support services. The goal of referral is to connect clients with services and support systems that can help them achieve and maintain recovery. Remember, on your exams, referrals help ensure that clients receive comprehensive care by linking them to the most appropriate resources based on their individual needs. When placing a referral, counselors should follow professional and ethical standards to ensure the client receives appropriate care. First, discuss the referral with the client and explain why the referral is being recommended. Whenever possible, involve the client in the decision-making process and respect their autonomy. Next, determine how the referral will be made. Some referrals are completed directly by the counselor through contact with the referral source, while others are initiated by the client with guidance and support from the counselor. Before sharing any confidential information, obtain the appropriate release of information forms. This ensures that information is shared legally and ethically. After the referral has been made, follow up with the client and, when appropriate and authorized, with the referral source. Follow-up helps confirm the client was able to access services and allows the counselor to address any barriers that may arise. And finally, document all referral activities, including the reason for the referral, resources provided, releases obtained, and follow-up efforts. Remember, on your addiction counselor exam, effective referrals involve communication, collaboration, confidentiality, follow-up, and documentation. When studying for your addiction counselor exam, focus on a few key principles. First, counselors should obtain client consent and protect confidentiality before sharing information with outside providers. This typically requires a signed release of information. Referral should also be made when a client's needs exceed the counselor's competence, scope of practice, or available resources. The referral should always be based on the client's specific needs and circumstances. Next, counselors should follow up appropriately after the referral is made to help ensure continued care and address any barriers to accessing services. And lastly, remember that referrals must be documented. Exam questions often test your understanding of confidentiality, informed consent, scope of practice, and proper follow-up procedures. If you're unsure of an answer, choose the option that best protects the client's welfare while maintaining ethical and professional standards. Question 1. A client in outpatient substance use treatment reports experiencing persistent auditory hallucinations, severe mood swings, and difficulty functioning at work. The counselor recognizes that these concerns require services beyond the counselor's scope of practice. What is the most appropriate action? A. Continue providing substance use counseling and encourage the client to discuss the symptoms during future sessions. B. Refer the client to an appropriate mental health professional while continuing to provide support within the counselor's scope of practice. C. Terminate services immediately because the client's needs exceed the agency's capabilities. Or D. Advise the client to search online for mental health resources and decide independently which services to pursue. The correct answer is B. Counselors should identify needs they cannot meet, explain why the referral is being made, and connect clients with appropriate resources while continuing to provide services within their scope of practice. A is incorrect because the symptoms indicate a need for specialized mental health services. Delaying a referral could place the client at risk. C is incorrect because a referral does not automatically require termination of services. And D is incorrect because counselors should actively assist clients in assessing appropriate resources rather than leaving them to navigate complex systems alone. Question 2. A client asks the counselor to coordinate care with their primary care physician regarding substance use treatment. Before sharing any confidential information, what should the counselor do first? A. Contact the physician and provide only limited treatment information. B. Ask a family member to confirm that communication with the physician is appropriate. C. Document the client's request and immediately send treatment records to the physician. Or D. Obtain a signed release of information authorizing communication with the physician. The correct answer is D. D is correct because counselors must obtain a signed release of information before sharing confidential information with outside providers, except in specific situations permitted by law. A is incorrect because even limited information cannot generally be shared without proper client authorization. B is incorrect because family members cannot authorize the release of confidential information unless legally permitted to do so. And C is incorrect because documentation alone does not replace the need for a signed release of information. Question 3. A client becomes frustrated when the counselor recommends a referral to a psychiatrist. The client states, "Why can't you handle this yourself? I don't see why I need another provider." What is the most appropriate response by the counselor? A. The referral is required by agency policy, so there is nothing else we can do. B. Most clients with similar concerns are referred, so you should follow the recommendation. C. I am recommending this referral because the psychiatrist has specialized training that can better address your specific needs while I continue supporting your recovery goals. Or D. If you do not accept the referral, we may not be able to continue working together. The correct answer is C. C is correct because counselors should explain the reason for a referral and help the client understand the benefits of the referral. A is incorrect because this response does not explain the clinical reason for the referral or involve the client in the process. B is incorrect because referrals should be based on the client's individual needs, not on what happens with other clients. And D is incorrect because this response may feel coercive and does not appropriately explain the purpose of the referral. Question 4. A counselor referred a client to a community mental health provider for additional services. 2 weeks later, the client returns for a scheduled session. What is the most appropriate action by the counselor? A. Assume the referral was completed successfully unless the client reports a problem. B. Wait until the client finishes treatment before discussing the referral outcome. C. Contact the referral source immediately, regardless of whether a release of information has been signed. Or D. Follow up with the client to determine whether the referral was completed and identify any barriers to accessing services. The correct answer is D. D is correct because counselors should follow up after a referral to support continued care and address obstacles that may prevent the client from receiving services. A is incorrect because counselors should not assume a referral was successful without follow-up. B is incorrect because delaying follow-up may allow barriers to treatment to go unaddressed. And C is incorrect because contacting the referral source requires appropriate authorization and may violate confidentiality if no release of information has been signed. Question 5. A client receiving substance use counseling reports frequent binge eating episodes, intense feelings of shame related to eating, and concerns about weight gain. The counselor has limited training in eating disorders, and the agency does not provide specialized eating disorder treatment. What is the most appropriate action by the counselor? A. Focus only on the client's substance use concerns and avoid discussing eating behaviors. B. Provide advice about dieting and nutrition based on personal knowledge and experience. C. Discuss the client's needs and refer the client to an appropriate eating disorder specialist while continuing services within the counselor's scope of practice. Or D. Wait to see if the binge eating improves before considering additional services. The correct answer is C. C is correct because counselors should identify needs that they or their agency cannot adequately address and assist the client in accessing appropriate specialized services. A is incorrect because ignoring a significant client concern may prevent the client from receiving needed care. B is incorrect because counselors should not provide services outside of their training, competence, or scope of practice. And D is incorrect because delaying a referral may prevent timely intervention and support. Question 6. A counselor determines that a client would benefit from psychiatric services. With the client's consent, the counselor contacts a psychiatrist, schedules the appointment, and sends the necessary documentation to coordinate care. This is an example of which type of referral? A self-referral. B, informal referral. C, direct referral. Or D, community referral. The correct answer is C. A direct referral occurs when the counselor actively assists with the referral process, such as contacting providers, scheduling appointments, or coordinating care. A is incorrect because a self-referral occurs when the client independently contacts and arranges services without the counselor facilitating the process. B is incorrect because an informal referral typically involves providing information or suggestions without actively coordinating services. And D is incorrect because community referral describes the type of resource being used, but not describe the referral method. Question 7. A client is receiving substance use counseling, medication management from a psychiatrist, and supervision through probation. The client has signed appropriate releases of information allowing communication among providers. What is the primary purpose of care coordination? A, to ensure each provider focuses only on their specific service area without influencing other aspects of treatment. B, to allow providers to share information and coordinate services that support the client's overall treatment and recovery goals. C, to determine which provider is ultimately responsible for directing all aspects of the client's care. Or D, to increase the amount of information exchange among providers regardless of its relevance to treatment. The correct answer is B. B is correct because care coordination promotes communication, collaboration, continuity of care, and alignment of services to support client outcomes. A is incorrect because providers should communicate and collaborate rather than work in isolation. C is incorrect because care coordination is not about assigning control to one provider, but about teamwork among professionals. And D is incorrect because information sharing should be limited to what is relevant, necessary, and authorized by the client. Question 8. A counselor refers a client to a community mental health provider for specialized services. The referral has been discussed with the client and the appropriate release of information has been signed. Which documentation entry best reflects appropriate referral documentation? A. Document the reason for the referral, resources provided, client response, release of information obtained, and any follow-up efforts related to the referral. B. Document the referral source's qualifications, treatment recommendations, expected outcomes, and all future services anticipated by the referral provider. C. Document that a referral was made, summarize the client's treatment history, and include all information discussed during previous counseling sessions. Or D. Document the referral decision, provide a detailed description of the referral agency, and record all communications expected to occur after treatment begins. The correct answer is A. A is correct because referral documentation should include the reason for the referral, resources provided, client participation, releases obtained, and follow-up activities. B is incorrect because counselors are not expected to predict treatment recommendations or future outcomes from another provider. C is incorrect because documentation should be relevant to the referral and not include unnecessary information unrelated to the referral process. And D is incorrect because while referral details may be documented, counselors cannot document future communications that have not yet occurred. Question 9. A counselor is coordinating services for a client who has been referred to an outside provider. The outside provider requests information about the client's treatment progress. According to laws, regulations, and ethical standards governing confidentiality, what should the counselor do first? A. Share information that is clinically relevant because the referral provider is involved in the client's care. B. Verify that appropriate authorization exists before releasing any confidential client information. C. Provide a summary of treatment progress but withhold information related to the substance use history. Or D. Release only verbal information and avoid sending written documentation to protect confidentiality. The correct answer is B. Counselors must follow laws, regulations, and agency policies by ensuring appropriate authorization, such as a signed release of information, exists before sharing information. A is incorrect because involvement in the client's care does not automatically permit disclosure of confidential information. C is incorrect because even limited disclosures generally require proper authorization unless exception applies. And D is incorrect because confidentiality requirements apply to both verbal and written communications. A client in substance use treatment reports symptoms of depression, difficulty maintaining employment, unstable housing, and limited family support. The counselor identifies several needs that cannot be fully addressed through substance use counseling alone. What is the primary benefit of making appropriate referrals for this client? A. Referrals allow the counselors to transfer responsibility for addressing the client's additional concerns to outside providers. B. Referrals help reduce the number of counseling sessions needed by ensuring other providers manage the client's needs. C. Referrals provide the client with access to multiple services that address a broad range of needs and support overall recovery. Or D. Referrals ensure that each identified need is addressed separately without requiring communication among providers. The correct answer is C. Referrals promote comprehensive care by connecting clients with resources that address medical, mental health, housing, employment, legal, and recovery-related needs. A is incorrect because referrals do not eliminate the counselor's responsibility to support the client and coordinate care when appropriate. B is incorrect because the purpose of referral is not to reduce counseling sessions, but to ensure the client receives needed services. And D is incorrect because comprehensive care often benefits from communication and coordination among providers rather than isolated services. For additional study resources, please see the link in the description. Please subscribe so you never miss a weekly study video.